Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Piver-Routledge classification of hysterectomy. According to Piver-Routledge classification of hysterectomy, there are three types of hysterectomy. Type 1 or type A hysterectomy is simple hysterectomy where uterus and cervix is removed. It is also called as transabdominal hysterectomy. It is the most common hysterectomy done in benign causes like fibroids. Here the age is less than 45 years. There is no bilateral. If the age of the patient is less than 45 years, then no bilateral salpingo-oophorectomy is done. If the age is more than 45 years, then bilateral salpingo-oophorectomy is done. Stage 2 or stage B. In stage 2 or stage B, we have Wertheim's hysterectomy or modified radical hysterectomy. In Wertheim's hysterectomy or modified radical hysterectomy, uterus, cervix, both the ovaries and tubes with 1 centimeter of vagina and media, which is half of the cardinal and the uterosacral ligaments, and also 1 centimeter of vagina and the upper part of uterine artery are removed. So all this is type 2 or type B Wertheim's hysterectomy, where we remove the uterus, cervix, both ovaries and the tubes, 1 centimeter of the vagina, medial half of the cardinal and uterosacral ligament, 1 centimeter of vagina and a part of uterine artery is removed. In type 3 or type 3 and type C, we do radical hysterectomy or mixed hysterectomy. In radical or mixed hysterectomy, uterus with cervix, ovary with tubes, and more than one third of the vagina and entire cardinal ligament or entire uterosacral ligament and a large part of uterine artery are removed. Type 2 and type 3 hysterectomy are done for malignancy. According to this classification, a lymph node dissection is done based on the endometrial report. So endometrial report will classify it as type 1 or type 2 tumor. If there is type 1 tumor, if the in type 1 tumor, if the that is endometrial biopsy classifies it has either type 1 endometrial carcinoma or type 2 endometrial carcinoma. If it is a type 1 endometrial carcinoma and if it is confined to uterus, then MRI report should be seen, and in the MRI report, if you see that there is less than 50% of myometrium is involved and the tumor size is less than 2 centimeters, in such case no intervention is done. If less than 50% of myometrium is involved and there is more than 2 centimeters of pelvic lymph, if there is more than 2 centimeters of tumor size is involved, in such cases we should do pelvic lymph node dissection. Then if there is involvement of more than 50% of myometrium and if there is pelvic and para-aortic lymph node dissection should be done. If there is more than 50% of myometrial involvement, then pelvic and para-aortic lymph node dissection is done. If the tumor is extrauterine, then pelvic and para-aortic lymph node dissection is done. Type 2 tumor. Type 2 tumor you will do in pelvic. For type 2 tumor, pelvic and para-aortic lymph node dissection is done.
thank you and thank you for watching.